So if we take them away on activity days so that they can see the work environment of a hospital, seeing what the staff do, so that they are encouraged and excited to further their education to be like one of those people. Personally, for myself, I didn't meet Kia ora hauora till I was 16. However, if I was to meet an organisation like that when I was younger, I feel as though I could have encouraged more people, my whānau, my friends, to join the journey with me on furthering their education. I feel as if we implicate this into the system, then my mokopuna and others will thrive if this is the profession that they choose to do.
Oh, I love this question, and my response always will be to not have to meet criteria to be able to access the resources and services that are available. You know, there's so many services available out there, but most of them you have to meet certain criteria. And the other thing is for our cultural practices to be recognised within the health sector, so meaning rongoa, Māori, mirimiri, etc., etc. That is a biggie for me.
Tamariki mental health, more mental health literacy promotion in those early years, or more health promotion in general. So we're empowering those kids to sort of, and whakamana, you know, we're sort of enhancing the mana of those kids so they can thrive and grow in the way that they want to, and that the way is natural for them, you know. So I think, yeah, prevention is a big thing, and it's much easier to prevent these, like mental health in particular, than it is to treat it, you know. At the moment we've got such a backlog of people waiting to get care, and you know, mild mental health disorders have next to no care options, support options. So if you're not lucky enough to have a supportive group around you, it's difficult, you know. So yeah, we should be enhancing and empowering people from the start of their lives so that they can essentially become more actualized people.
I'd love to see systems that address our barriers so that financially, spiritually, we can access and get the help we need.
My main thing is for access to high quality healthcare at an affordable price. I don't think many people would disagree in saying that health is such a fundamental aspect of our lives, and so the opportunity to look after and maintain our hauora is really, really important.
What I would like to see is more limitations being set upon the industries that are causing the harms that we are seeing in our communities. At the moment, there is so much emphasis on the community itself to fight back against these obesogenic, carcinogenic environments and to just do better. What I would like to see is that focus shifting from it being the fault of the person affected and more towards the industry. The interest of industries is not more important than the health outcomes of our people, and that seems like a really obvious statement, but somehow that's a very hard thing to convince a lot of people of.
It's so encouraging to read and to see the rates and statistics of, Māori entering into workforces, going to university with intentions of completing degrees. It makes me feel so hopeful for the future for our mokopuna to be able to live in the reo, in the culture.
That people do not take advantage of those with a disability. I want to be seen as an equal even though I'm in a wheelchair.
Personally, I would like to see more affirmative action in reducing barriers for Māori to be in employment in the health sector. From working with Kia ora hauora, a Māori health workforce development program, I often see the barriers that stop Māori from the beginning, continuing or finishing a health career. And it starts from education really. So I think it's a whole pipeline change that we must look at from the start, because without those essential foundations that Māori tauira need, especially within secondary school, retaining sciences, continuing on in sciences to level 3, in order to have those UE and base knowledge to go into a tertiary education in a health career, I think is really important to first look at, in order to look at why our workforce is so low in comparison comparison to the consumer rate that we see in the hospital, with Māori being the biggest consumers of health services. And I hope to see more clear directive from public and private institutions showing a pro-equity lens towards Māori in all aspects of recruitment, employment and retentions. And I hope to see those directives backed and supported by not just the Māori Health Directorates or the Māori Health team, but by the CEO and the executive leadership positions, and those in power to solidify these intentions and make more Māori feel welcome in these historically Eurocentric institutions and systems. But yeah, despite I know my own tendencies to engage in Māori services personally, such as Kia ora hauora, I see how this can miss a lot of Māori rangatahi tauira who don't necessarily have those skills to engage and ask for help and need that extra support from us to help them into our health systems.